Even in the midst of the COVID-19 pandemic, the opioid epidemic continues to hit communities hard throughout the country and right here in Ohio. The Ohio Attorney General's office says the death rate from opioid overdoses in the second quarter of 2020 was the highest in 10 years. Now, a Summit County father who lost his son to an opioid overdose is hoping a new bill can help families better cope with addiction before it's too late. News 5's Jay Jarvis with that story.
It's been 6 years since Greg McNeil lost his youngest son, Sam.
He had the best sense of humor. He was generous, and he was fun-loving.
Sam was also selfless. Back in 2007, McNeil says Sam was at a party and was beat up badly while defending a young woman. He wound up in the ER, had screws put in his face, and underwent some plastic surgery.
And they sent him on his way with some opioids. It just took him weeks to get addicted to that.
Soon, Sam became hooked on heroin. McNeil says they sent him to 2 rehab facilities over the years, one in Ohio and another in Florida. And they helped, but Sam eventually relapsed. In October 2015, Sam overdosed on heroin laced with fentanyl.
He didn't stand a chance. They found him the next day, alone, gone. And obviously that changed our lives forever.
After Sam's death, McNeil started a nonprofit called Cover 2 Resources, which works to highlight people and programs making a difference in the opioid epidemic. That's why he's now backing the Non-opioids Prevent Addiction in the Nation, or NOPAIN Act. The bill, introduced by Ohio Senator Rob Portman, aims to increase access for patients and doctors to non-opioid forms of pain management.
Be it acupuncture, be it nerve blocks, there's many things out there, alternatives to opioids.
McNeil believes right now is a critical time for the bill to be introduced and passed, with opioid deaths on the rise. In addition to the Ohio Attorney General's warning, health officials in Stark, Summit, and Cuyahoga counties have reported spikes in overdose deaths.
That population that's struggling with opioid use disorder has been very much impacted by laying, as I said, a pandemic on top of an epidemic that way.
He's hoping the legislation will make a difference for families struggling with addiction, so they don't have to endure the pain his family has.
I think it's time for us to put families in the driver's seat and give them the opportunity to make the decisions for themselves. But we have to start by not making it a disincentive for the doctors to do that.
Jay Jarvis, News 5.